Okay, because our introductions will take a few minutes because we have some very accomplished people who've taken the time out of their busy schedules to join us this evening. I'd like to join those of you who like to thank those of you who joined us this evening for this very important conversation. I will go ahead and begin with our panel introductions. And first up, Allison, I'm not sure if you want me to just start from the sheet, or are we in the same order in terms of what you presented, what you sent over?
Should be in the same order.
Okay. In that case, we are going to begin with attorney Mawuli Davis. He is the chairman of the Black Man Lab and a member of Let Us Make Man. I'm also very proud to say that he is a DeKalb County resident. Attorney Davis is co-founder of the Davis Bozeman Law Firm, and he leads the firm's criminal defense and trial divisions. He's a graduate of the United States Naval Academy and Georgia State University's College of Law. Attorney Davis co-founded the Davis Bozeman Law Firm in 2007 with his friend and law school classmate, attorney Robert Bozeman. The Davis Bozeman firm handles personal injury, wrongful death, criminal defense, and civil rights cases, with a combined 25 years experience practicing law. The firm is community-based and has handled some of the highest profile civil cases of modern day. In August 2012, Attorney Davis was selected as a rising star by Super Lawyer magazine. This is one of the highest honors that an attorney under 40 or with less than 10 years in practice can receive. Less than 3% of all lawyers in Georgia receive this honor. So it really warms my heart to have him here and be such a resource for us this evening. Last year, he was named Civil Rights Attorney of the Year by the Gate City Bar Association, and currently is a reoccurring legal guest commentator on Truth TV's In Session. Attorney Davis is described as an activist attorney because of his passionate work in the community and advocacy in the courtroom to save young African-American men. Thank you so much for joining us this evening, Attorney Davis. Next in queue, we have Dr. Rochelle Dicker. She is Vice Chair and Chief of Surgical Critical Care at UCLA's Department of Surgery. Dr. Dicker is a professor of surgery and anesthesia and Vice Chair for Critical Care at UCLA. She is the co-director of the program for the advancement of surgical equity, and her surgical residency was spent at University of California, San Francisco, and the University of Vermont. She then went on to complete her trauma and critical care fellowship at UCSF. And in 2004, she started the Wraparound Project at San Francisco General Hospital, where she joined the UCSF faculty. Wraparound is one of the founding members of the Health Alliance for Violence Intervention. It is a network now of over 40 nationwide hospital-based violence intervention programs, and she serves as the board chair. She has contributed to over 90 peer-reviewed publications and several book chapters, and we are grateful this evening to have Dr. Dicker join us for this critical conversation. Next in queue, I show Alfred Garner. He is the Director of Zone 3 Community Initiatives and CRIS 180. CRIS 180 is a program of which I'm extremely familiar, and it has an invaluable impact within our communities. But Mr. Garner, Alfred Garner II, he joined CRIS 180 in 2016, and he's directly responsible for programs in the city of Atlanta's NPU-V community, including recruiting and training residents to facilitate community trauma resource networks and healing circles. Alfred serves as the program manager of the Second at Promise Youth and Community Center and manages the Cure Violence Atlanta program. He has an extensive history of working to improve the lives of children and families in the Atlanta community, and he's worked for the Department of Family and Community Services, Atlanta Public Schools, Fulton County Schools, and Communities in Schools. Thank you so much for taking the time to be with us this evening. and we appreciate your presence with us, Mr. Garner. Next in queue, we have Ms. Natallie Keiser. She is the Senior Associate Community Economic Development, Atlanta Civic Site of the Annie E. Casey Foundation. As many of you may know, the Annie E. Casey Foundation is on the cutting edge of research and activism within communities that has one of the greatest impacts of any foundation in the United States. With over 25 years of experience in housing and community development, Natallie Keiser leads the foundation's neighborhood transformation efforts in the Atlanta Civic Site. Before joining the foundation, she ran a community development consulting practice for strategic planning, project management, group facilitation, fundraising, interim leadership, and board governance. And she coordinated Atlanta's Neighborhood Lift, which is a down payment assistance program helping 375 people become homeowners. This evening, we'd like to thank you so much for your work and your advocacy, Ms. Keiser, and thank you for being a part of this conversation. Next, we have Mr. DeAngelo Mack. He is the Director of Equity, Justice, Public Health Advocates, and Mr. Mack is the Director of Equity, Justice for Public Health Advocates. At 6 years old, the Feed the Children infomercials changed the way he saw the world. After seeing children and families impoverished, starving, and dying, he felt extreme empathy for those who were hurting. And seeing these disparities opened his eyes to see similar issues within his own community. Today, he works on tearing down barriers to access through education, awareness, and policy change. This has become his mission. And thank you so much, Mr. Mack, for joining us this evening. And we now have Dr. Yolanda Wimberly. She is the Senior Vice President and Chief Health Equity Officer for Grady Health System. And I know that you're very new to the role. Of course, Grady is a very valued partner here in DeKalb. You all provide all of our indigent care assistance for those who do not have medical insurance, and we're very proud of the relationship. But Dr. Hill Wimberly is a double board certified physician, professor of clinical pediatrics and adolescent medicine, and an innovative healthcare organizational and educational leader in healthcare. Her expertise lies in the development and implementation of cutting-edge medical curriculum and the education of physicians in medical decision-making, cost-effectiveness, and best clinical practices to build the next generation of top quality medical professionals. Her list of credentials goes on and on, but it was through her and our conversation of introduction that this town hall was birthed as we began to talk about violence within our communities and what is being experienced within hospital environments. So thank you so much for your commitment to the community and for working with us here in DeKalb, Dr. Wimberly. I look forward to a long relationship. And last but not least, we have Mr. Nate Snyder, and he is our community intervention worker. And Mr. Snyder is a community worker at the Rose Family Creative Empowerment Center in Sacramento, California, as well as a campus mentor at John Steele Middle School and a volunteer at the Juvenile Detention Center in Sacramento, California. I understand that you all are actually here in our fair city in Metro Atlanta. And, this conversation is absolutely great since we have your presence at the moment. I'm not sure if there was a slide for me, but those of you that are on the call know that I am your commissioner. I don't care where you live in DeKalb. I represent all 780,000 wonderful DeKalb residents through my service as the Super District 7 Commissioner. This evening, to set the tone for the conversation that we're about to have, we are going to watch a brief 3-minute video, and thereafter, we will have a presentation by Ms. Keiser, and immediately following, a very informative discussion. At this time, Allison, if we can have the video. Thanks so much for sharing the video. I think it does a good job of showing and pointing out a lot of violence that we're seeing in our communities. But not all violence takes place in the street. We have seen a tremendous rise, an increase in violence within homes. Now, of course, we are dealing with a global pandemic. And this evening, we'll have a conversation that attempts to unravel and unwrap some of what we're seeing. At this time, we're going to move into a presentation by Ms. Natallie Keiser. And thereafter, we will then begin the conversation. And thank you so much. At this time, if we can bring up or at least forward to Ms. Keiser, the ability to share screen, that would be wonderful.
Thank you very much, Commissioner Cochran-Johnson. I really appreciate the opportunity to have this conversation. I am going to be focusing on community gun violence. You talked about there are many different aspects of violence, but that is the focus of my remarks. So next slide, please. I'm here this evening to speak from the perspective of a national foundation that focuses on young people. Next slide, please. Safety is fundamental for children to be able to fulfill their potential. We entered into our community safety work because we found that neighborhood gun violence was interfering with our other investments to help children and their parents achieve better educational opportunities, economic opportunities. As everyone knows, it's difficult for children to learn and for parents to work when they feel threatened, when they feel like their safety is threatened. Next slide. So at the Casey Foundation, our safety theory of change is that by investing in community-led solutions and equipping residents with the tools and support they need to be peacemakers, we can help communities address and heal from the underlying causes of violence. And as you see on this slide, we do this work through capacity building for community-based organizations, through education and advocacy, and through research. Our theory of change was derived from our understanding of the causes of community gun violence. According to the Centers for Disease Control and Prevention, gun violence is the leading cause of death for Black youth ages 15 to 24. And there's a clear racial equity issue in the limited investment that occurs in research and prevention and healing relative to other leading causes of death and the investment that we see in those areas. The causes and effects of gun violence, as we saw mentioned on the video, are very complicated and nuanced. And that the effects of gun violence create trauma at a community level. We know that violence often begets more violence. And we know that people who have been hurt often hurt other people if they are not given the opportunity to fully heal from the violence they've experienced. Research shows the violence can be contagious and can spread like a disease. And we also know that trauma from violence can manifest itself at the neighborhood level. The interactions between cause and effect are complicated. And we also know that white-led systems have under-resourced Black and Brown communities, and that these communities have been left with disproportionate levels of violence and trauma. Next slide, please. Thus, in our community safety work, we've gradually developed these principles that you see on this slide to recognize that gun violence is preventable. It's not inevitable, which is what we hear in the dominant narrative. Research shows that less than 1% of a city's population is responsible for 60% of the gun-related violence. Healing-centered practices are necessary for turning the trajectory, and concrete opportunities for historically under-resourced communities are essential. Community members who experience the violence are essential to the solutions. And we must address and name the historically racist practices that are at root of much of the violence. Next slide. Here's an overview of some of the work that we're doing nationally before I turn to what we are doing in Atlanta. I'll just note a couple of these examples. We are part of a national group called the Fund for Safer Futures, which tries to encourage others in philanthropy to come together and to focus on this issue and to share lessons with each other. We have community-based interventions that we're supporting in 3 other locations in addition to our work in Atlanta. And we're part of the White House's national initiative to support community-based violence intervention in several cities. Atlanta is one of those. Next slide, please. Next slide. So as I talk about our work in Atlanta, I'll use this map to orient us. Everybody's pretty familiar with this, except for maybe our California friends, but our work is focused on the Neighborhood Planning Unit V neighborhoods in the city of Atlanta, which is at the intersection of 75, 85, and I-20 on this map, just a little bit southwest of that. And these are the neighborhoods of Adair Park, Mechanicsville, Peoplestown, Pittsburgh, Summerhill, and Capitol Gateway. And this has been one of the city's hotspots for gun violence for many years. Next slide. So our work in these neighborhoods was co-designed with community residents and community stakeholders. We're not a foundation that has considered ourselves to have a deep history in the safety space, and we needed lots of partners to come together and think with us as we launched into this work. And that co-design process resulted in these components here that you see in this slide as being the areas that the community wanted to focus on. So they wanted to work to address historic and ongoing trauma. They wanted to be at the table with systems that directly impact safety, such as supporting Grady Hospital's interventions in preventing gun violence, which I think you'll hear more about later. They wanted to support immediate interruption and mediation of gun violence incidents on the street. And they wanted to work to tell a fuller story about how this public health approach can address community safety. The nonprofit Chris 180 was selected to be our local implementing organization for the trauma response and violence interruption work. And they were selected by a committee, by the committee of community members that I mentioned previously. Alfred Garner of Chris 180 is here with us this evening. So I'm going to turn to him for the next few slides so he can share what that work looks like. Next slide.
Thank you, Natalie. So what we're going to do now is kind of go through the process of what our trauma response network looks like from the time that we receive information about an incident, how this essentially flows. We work directly with first responders to, first of all, vet the information to make sure it's accurate and make sure that it's true, so that we can be able to share reliable information to the community. Then we train residents in the community in how to make sure that this process goes through with fidelity. So within this process, the community leaders utilize a rubric that we created to ensure that we're really being intentional about addressing gun violence in our target area. So we go through this rubric process, identify if we need to deploy out. And once we do that, trauma responders literally are going door to door, block to block, checking on folks to make sure that they're okay, to share information, to ensure that they're safe and secure, and to ultimately invite them to engage in a civic association process, healing spaces, but also refer them to any other resources that they may need. After that, you know, because this work is heavy work, you know, it plays a lot on your mental health. And because we recruit residents and stakeholders in the community, we want to make sure that they're okay. So once we complete our deployment process, we make sure that we debrief in the parking lot or wherever our centralized space is, and make sure that we debrief, make sure everybody's okay before they go home, and then complete the paperwork that's directly attached to that. Next slide, please. Fast forward, we jumped into space on the prevention side and looking at how a Cure Violence Atlanta program would look like in our target area. Because we had a footprint in NPUV, had established relationships, it made sense for us to tap into this space. So a little bit about this proven public health approach that Cure Violence Global provides to us. It's about looking at it the same way we'll look at ultimately a common cold in a sense. We interrupt in the transmission of violence. You know, we utilize people with lived experience, which is very important. Utilize residents with lived experience in these areas to make sure that this whole process goes through with fidelity, right? As we identify the problem, transmit the violence, mitigating the risk. Community members are trained in a space to counsel individuals so that we can literally get in the middle of it and interrupt it. What does that look like? A possible mediation, you know, making sure that everybody understands one another and having a common conversation. May not necessarily agree, but we can agree to disagree in this space. If we can allow 24 hours to pass without somebody retaliating, our chances of them retaliating decreases. And ultimately establishing new norms. We do that by reclaiming space events. What does that mean? Having vendor events, cookouts, celebrating young people that plays at the parks and recs, having vendor fairs, making sure that we can connect people to resources. We've had vaccination events, all type of things to create new norms in these spaces. Most importantly, we want to look at how our spaces look. We know what community trauma looks like, and sometimes that comes with abandoned houses, illegal dumping, things of that effect. So we partner with other organizations and our trauma response team to make sure that we hit these hot spots, clean up, and make sure that we don't become accustomed with the way our communities look. Next slide. And we're going to go right back to Miss Natallie on this one. Thank you.
Now, Alfred can easily do this slide, but I'll take it.
I'll do it if you like.
This is the result of your work, Alfred.
I'll do it.
The first one at least refers to the work Alfred was describing, which is that although the city of Atlanta saw a 1% increase in homicides in 2021 compared to the previous year, the rates in NPUV fell by 46%. And so based on this progress, the mayor, former mayor Keisha Lance Bottoms decided to use American Rescue Plan funds to expand the work that Alfred described to 2 additional hotspot areas. So now the current mayor has set up the Office of Violence Reduction and formalized it to carry out this expansion and to carry out other non-enforcement methods for reducing gun violence. And so that work is just getting formalized and on the ground now, but we're very excited about it. And then as part of that White House collaborative that I mentioned previously, a national grantee of ours called Cities United is providing technical assistance to the city of Atlanta to help sustain the prevention efforts during this mayoral transition period. Next slide, please. So I just wanted to talk a little bit about this narrative change work, which I think is really important. We know that to have effective solutions for reducing gun violence, public support is necessary. And we've been really concerned about what we see in the media and public forums, that there are frequent inaccuracies. There are messages that just raise fear without pointing people towards solutions. There are tactics that invoke racist fears, and the narrative doesn't bring the public health frame and doesn't analyze root causes. And so we've been working to try to do what we can to contribute to a different narrative, which is you see the briefing report that's here on the left that we published. We've been trying to use that to reach out to the media. We worked with partners to do a series of op-eds in the Atlanta Journal-Constitution. We've done webinars like this. We also worked on a podcast that will be coming out soon. So just looking for any opportunity we can to help change the message. Next slide, please. And we've had plenty of lessons learned, but I'm not going to go through all of these. I want to be able to move on to the other speakers. I'll just highlight a couple of them. One is we all know our society is steeped in this culture of surveillance, arrest, punishment, and incarceration, and we don't seem to know another way or find another way. So opening these kind of prevention-oriented pathways is really difficult. We have to advance a message that peacemaking assets are within communities that people often label as violence plagued, and there can be skepticism about that. And the frequent undergirding of racism can make it really difficult to achieve the kind of change that we need. So we have to be determined and persistent. And it's hard for residents themselves who've not been exposed to alternative approaches to imagine what those pathways are. So it's really important that education be a part of it. So we have to expose people to what some of these other methods are that have worked in other places. And then after residents have the opportunity to learn from those peer locations and exchange ideas, then they can sometimes be the champions to help push this public will along so we can get to some of these positive violence intervention strategies. So I will close there. And again, really thank you for the opportunity.
We thank you for being present, and also thanks for the incredible information that you've shared with us. A lot of folks that are a part of this conversation, I'm trying to multitask. I'm watching the chat as we have the conversation, and there's concern or interest in data in terms of what age groups are we seeing. I think what we're going to find is that Black males between 15 and 24, number one cause of death is gun violence. But also, I believe it would be accurate to state that this is the number one category where we're seeing an increase in violent crime. Now, I know here in DeKalb County, Georgia, we have seen a drop in crime overall. However, what we're experiencing here in DeKalb is what you're seeing across the United States and in urban markets. It is a sharp increase in violent crimes, your murders, your homicides, your assaults. So at this point, I wanted to bring our attorney and DeKalb County resident, Mawuli Davis, into this conversation at this moment, because I know that often you represent these young men, and in many instances, you have programs where you are working with them. As a matter of fact, I just noticed about a week ago that there was a walkthrough in, I believe, South Fulton that was orchestrated by yourself as well as several other individuals, men who were concerned about the violence that they were seeing in their communities. And I want to say to everyone that's joined this call, as an elected official, we can legislate or we can create legislation, but we cannot legislate human decency and care, respect for human life. That begins in a far different way. So if you will, I would ask Attorney Davis that you share what you're seeing within the legal system and within the communities with the young men that you are working with.
Thank you, Commissioner. And again, I'm grateful to be a part of this conversation. Really grateful to see what Natallie and Brother Garner have lifted up in terms of these other approaches. We have seen, and I have over the 20 years of my legal career, I've just seen how the system itself, in terms of the crime and punishment mentality, has not worked. And so we started years ago programming and presentations for young people called The Consequences of Thug Life, to try to get the young people to reflect about the decisions that they were making and how we saw so many young people charged with armed robberies. My sons were victims of an armed robbery in DeKalb County when they were in high school. And so we've experienced that kind of violence on a personal level, but we believe that the work that is being done around prevention is what's necessary. And so the work we did the other week was simply go out and spread a message of love. And what that love looks like is the presence of African-American men in particular in the lives of young African-American men. And so our nonprofit Black Man Lab and Let Us Make Man were just two of the organizations that we went out, we took flyers door to door, knocking, to try to communicate with each household in an apartment complex, 3 different apartment complexes. I'm literally sitting at the YMCA now because every Monday we have a Black Man Lab. And one of the things that we were doing was inviting the community. It's just like church, right? The power of church is not what happens on Sunday in the church. It's what happens when the folks in the church go out into the community and they live their conviction. They live what it means to show love and to bring grace and mercy to others. And that's what we're trying to create. Largely what I saw discussed in the presentation is creating these different kind of norms. So every single Monday, we have a space that is just for Black men here at the Andrew and Walter Young YMCA called the Black Man Lab. And it is what we describe as safe and sacred space for Black men, healing space where we can cry, where we can laugh, where we take deep breaths, learn how to meditate, and where we connect one to another and we get information about economic development, our personal development, dealing with trauma. And it's done in a way that we've just seen it continue to grow. Before the pandemic, we had nearly 250 Black men coming every single Monday, which is unheard of.
Absolutely.
For any program, like that. So our response as a firm has been to support the preventative work, creating a space where we can gather and love and nurture and encourage, because we say in the Black Man Lab that we have to be healers and builders, as well as nurturers. And so that's what we're trying to create, a different mindset other than what we see so often portrayed in the media. And when folks are trying to get elected as we got to get these thugs off the street. These are young people who we should love more. And if we loved more, then they wouldn't be looking for the love from gangs. And I just think that conversation around gangs has to be included as well. But I know my time. I appreciate, again, I look forward to working with everybody here and expanding the work that we're doing. We're going to be coming to the cab in a couple of weeks to walk and knock on doors in those. A lot of them are hot apartment complexes.
And let me, I have to interject because I know you have a hard cutoff. And, I think the reason you've been so successful, because you're absolutely correct to say that you're having 200 to 250 young men come out to participate is unheard of. And I believe that we have finally reached a point where we've realized that as it relates to addressing these issues, it's going to take a strategic, targeted approach. When you sit there I paid careful attention when I saw you all walking, because as a general rule, we know where the hot spots are. We know where the children are that are in need of the intervention. And oftentimes, unless we show up at the door and we present ourselves and solutions, these children, we think in school, we send children to school for reading, writing, and arithmetic, but they're not teaching conflict resolution. They're not teaching soft skills. In many instances, there may be trauma that they are not even equipped to deal with because these children don't have a safe space to have the conversation. So I just want to say to you, in terms of what you're doing and the mentorship, I just need to hear from you in terms of what it is you need from me from a financial standpoint, so that you can bring this work to the cab. Because I promise, when I saw you in South Fulton, I'm thinking, what is he doing there? I know what we're dealing with in our justice system. and you understand it firsthand. So whatever is necessary from my office, you have that commitment right now for that financial contribution so that we can address this issue, because it's going to take conversations and the intervention you're doing on the grassroots and ground level in order. Right now, I can send you to Wesley Club Apartments. I know, like you, where these hot spots are. So I look forward to working with you, and I appreciate your work in this space, because incarceration alone isn't the key. That's not the key. And we're not seeing it deter crime.
No.
So before you walk away, I wanted to give you some minutes here to have your closing remarks.
I appreciate that. I'll say this. Let me just give you all, if you could imagine what's about to happen here at the Y. We're going to go in. We're going to get all of everybody in the room to take 3 deep breaths. And what we say is, think of how many young people, how many Black men are incarcerated because they didn't take a deep breath before they made a decision. That's where we start every single Black Man Lab. And then we go from there to just communicating the power, the resiliency, and just affirming each other and affirming the warrior spirit that we have, right? We're in a system that has historically oppressed Black people in general, but Black men in particular. And so there's a warrior in us that says this isn't right. But unfortunately, when we don't have the proper outlets, that warrior can be turned on each other. And so we affirm the warrior spirit in us, but we also affirm the builder and the healer that's necessary. And then we have a moment that we invite up any of the brothers to come to the front of the room and get love. And what that looks like is that one of these young men or an elder will come up to the front of the room, and then every man in the room will come up and hug them. And so we're breaking all of the stereotypes about Black men not supposed to cry, you're not supposed to hug, you're not supposed to look each other in the eye. We're dead in all of that, because we know in this moment, love is what's necessary. And the more we love on each other, the more we invite healing into our homes and into our families and into these spaces. So I look forward to working with everybody on the panel. And we've got a Promise Center right here next door to the Y. So we're looking forward to, getting in there and coming to DeKalb and moving around. We were in Statesboro about a month ago, and it's everywhere. It's just needed. So thank you all. I'm sorry I can't stay to hear everybody else, but I will follow up with everybody here, and everybody gets dinner. So we serve dinner every night, because there are real issues around
food insecurities,
economic, you can't pay attention if you're hungry, right? We know that.
Absolutely.
So we do that every night and as well. So I look forward to connecting with everybody, and thank you so much for convening this important conversation.
Oh, thank you. Thank you for being present. And I'll look forward to us continuing to work together and me providing financial resources to assist you in these critical efforts. And as we move forward, Mr. Garner, I'm going to come back to you, because with Chris 180, you have focused strategically on youth. And in particular, I know that you have a large following of Black male youth. I did have a question that came in, and I want to unravel this right now from one of our community activists, Mr. Lance Hammond. And he stated, other than the age of the 1% of offenders that are imposing the trauma on the community. And that's very true. And this is why what we deal with is so alarming. By and large, this isn't a large group of individuals. It's a very small group that honestly engage in the bulk of the criminal activity that we see within our community. But again, his question was, what are we doing, and what is the underlying cause of this? I think Attorney Davis touched on it when he talked about, first of all, having a safe space. I think by and large, there's many individuals, and thank you, Allison, for bringing up the question, because the second part is there some base need they have that is unfulfilled, such as job, mental illness, peer pressure, or are some career criminals? I think there's always going to be some career criminals, but there's some that are on this conversation better suited to answer than myself. But you do find a direct link between economics and oftentimes what we see as it relates to criminal behavior, and particularly in youth, because they have a mentality of by any means necessary. Also, I believe in many instances, based on my readings and my research, oftentimes, that old saying, what you see, you will be. Violence is often a very learned behavior. And often it occurs when individuals are never taught or socialized in how to have conversations that de-escalate it. Because, we're dealing with here, how do we end crime or make a dent here when you're dealing with individuals who traditionally do not respect human life? So this comes down to a respect issue. So, Mr. Garner, I understand why Chris 180 was chosen, but talk to me a little bit about what you've seen and what you've experienced with the young men that are within your care in this organization.
Yes, ma'am. So we primarily work with the young adult age range between 17 and 24. But in part of other responsibilities and partnerships, what we do see is a lot of 16 and under youth have access to firearms. So what we do know is in the city of Atlanta is a lot of things adults got to do to change, the behavior to that allows access to these things. One of the things that we talk about in terms of safety measures is don't leave your firearm in the vehicle. In the city of Atlanta, they had over 1,200 firearms stolen out of cars last year, right? So out of some of those numbers that we looked at earlier, 1,200 of them were stolen in the city of Atlanta. So that provides access to it. So we do see a lot of self-esteem issues. We do see a lot of trauma. We do see a lot of all of those things that you mentioned. So for us, what has been successful is the partnerships involved. Whatever you do well in DeKalb County, do that well, but also have a relationship that with somebody else that will allow you to be able to help young people. One thing that we had to do was just set aside pride and ego and understood what you do well so that you can be able to help these young people. So if it's around behavior health, life skills, being able to engage in the community, that's our strength. But when it came to substance abuse and housing and other things like that, we had to be vulnerable enough to say that's not necessarily our strength. And then we can provide these resources to the child and the family. So that's the other part of it is not just working with the child in these spaces, you working with the entire family, being able to provide these resources. So I hope I answered that. But it's a vast amount of young people, like we're talking about 14, 15, 16-year-olds that have access to guns.
Absolutely. And, let me say as it relates to guns, because this is very deep and it could take a long time to unpackage. Over the Trump administration, we saw a huge spike in the purchase of guns across the United States because there was almost, it was perpetuated that the Second Amendment and the right to bear arms was at stake. And as a result, even here in DeKalb County, we processed, even during the pandemic, an inordinate amount of requests for guns, particularly near the end of his administration, out of a fear that a new administration would somehow limit that right. When you talk about the confiscation of guns, there was a question about gun buyback programs, but those have come under extreme scrutiny. And that's why you've seen those not taking place at the same degree and level that they had across the United States, because the NRA and a variety of other organizations have gotten involved. And now the requirements are quite stringent in order to host or hold a gun buyback program. But in terms of public health and what we're seeing, I know we have several individuals that are part of this conversation, including Mr. Mack, as well as Dr. Dicker. Can you speak to what we're seeing in that space? Because there's a lot of issues that come together to cause the violence that I believe we're seeing. So I'm just going to make that blanket statement and allow you all to sort of take it and move it forward from there. And I'm sorry, Mr. Mack, you're on mute. Great. I saw you just come off.
Yeah, I see my colleague, Dr. Dicker, looking at me. So I'll start, and she's a good closer. So first of all, thank you for the invite all the way from California to join you in this great state of Georgia, city of Atlanta. I think we first have to preference this conversation with understanding that violence is a public health crisis. Right?
Yes.
And if we didn't have guns, violence would still be prevalent. And that's because we live in a country where violence has a tradition. There is a tradition of violence baked into the very fabrics of our country. From the very times this country was founded, right? It was founded on the backs of stolen people. It was savagely stolen from our Native brothers and sisters who were here already. And the economic engine that is America was built on violence. And so we were having a conversation just earlier, just about this very thing, about violence, and just how prevalent it is, and how violence equates to power, and how violence equates to success, and how violence equates to all of these things, the glorification, right? I heard Mr. Garner and the attorney talk about young people and the things that they're doing around supporting them. Are trying to change their mindsets around violence. But until we become innovative and really move on what we're seeing and have these really courageous conversations about where we've been and where we are, then we won't see the change that we're looking at, whether there's guns or not. I'm not at liberty to talk ad nauseum about the guns, but we're seeing a tremendous uptick around the country, and I can speak to California around stolen guns, around ghost guns, and we as a community are reeling. Myself and Nate, we're from Sacramento, California, and just the other day, yesterday, 2 in the morning yesterday. You all know that there was a mass shooting, right? And so when will we begin to have conversations about the history, right, of gun violence from the very beginning, where this country, you solved situations by standing back to back and walking 10 paces and turning and shooting someone, and that's how you solved your issue. These are things that are innate and built in and meshed into the very fabrics of who we are and what we are. So when we begin to look at this as a Black and brown issue, it's not a Black and brown issue, it's an us issue. And we really do need to take a look, have courageous conversations, and like the good attorney Davis, have some real alternatives to what we're seeing.
Absolutely. And, I thank you for sharing your statements, because, we do have a problem with guns on the street, but guns don't kill people, people kill people.
Right.
And when you start to unravel trauma, and I think that's where Dr. Dicker can come in, it's very deep. I know I have a rich history with DeKalb County Public Schools because, of course, as a parent, you are where your children are. And I was shocked as I began to take a deep dive in terms of parental engagement, because where you have involved parents, you have successful children. So I was very active in efforts to get parents into schools. And it was during that time that we started to look at data and statistics and the need for alternative schools. And we found that there is a high percentage of students in DeKalb County schools that suffer from PTSD. Now, for individuals that are a part of this conversation, for most of us that are my age, when you've heard of post-traumatic stress disorder, this was a condition that you associated with a man or woman who had fought a war, not a child and what they experienced within the home. So when we say that this is a public health crisis, there are wraparound services, and more schools are having to move away from a traditional space because you have to provide wraparound services, consultation, outsourcing of service, mental health assistance to children in order to give them a fighting chance in the classroom. Because as Attorney Davis said, when you have a child that is homeless, because there is homelessness in our schools, it's very difficult to educate and socialize a child when they are not living in a home. So Dr. Dicker, I want to encourage you at this point to join the conversation and share what you are experiencing, because your degree of knowledge there in terms of mental health is very vast, because you've been on the front line of violence from a health perspective.
Thank you, Commissioner. I couldn't have said it better myself. The whole time I'm thinking trauma is deep, and you just said it. You just said it out loud. I think it's really important from the vantage point of someone who doesn't treat guns, but treats bullet holes, to wrap our heads around this idea of violence being a public health issue. And I think Ms. Keiser, Mr. Garner, Mr. Davis, these solutions are so exciting to hear about, to come to Atlanta and see all the ingredients are there and the appetite is there to move forward in a public health perspective. Because really, public health, that means there are root causes, there are risk factors, but there are also protective factors. There are things that you're already doing and that you can do as a community coming together to link up to create that violence prevention ecosystem. And it starts with just what you said, addressing the mental health, because so many of our victims of violence, victims, perpetrators, whatever it is, vulnerable communities have trauma that is not just a violent injury. It's not just a gunshot wound. It's much deeper than that. It's adverse childhood experiences. It's toxic stress. It's generations of structural racism that have led to these social determinants that create 40% of our well-being or our lack thereof. And we have this great opportunity to actually address it through hospital-based violence intervention programs, credible messengers, and actually addressing these root causes like employment and education. And like I said, you have all these ingredients here, and you have a great ecosystem already in the elements that were already brought up. So there are more than 40 programs in the country that are hospital-based violence intervention programs. They work with brothers and sisters at Cure Violence to create a citywide effort, certainly countywide efforts, to really go to the heart, to the root causes, so that we can reduce the violent injury and trauma that happens in our communities.
Absolutely. And at this point, I want to directly engage Dr. Wimberly, because of course you are our Grady Health System partner. And I know here in DeKalb, because there's so much to talk about, there was some conversation given earlier from Ms. Keiser concerning investments that were made by Atlanta in terms of crime prevention. I will say that, out of all the things that we've experienced here in DeKalb County, that over $30 million of our ARP funding was directly linked to crime prevention and programs that are associated with the reduction of crime, because it is a public health crisis. And it is costing us a tremendous amount of money in addition to the lives and the trauma that it causes communities. So I wanted to have you sort of weigh in at this point because I know that we have several programs. I know we've invested a large part of our funding there because public health and policing is honestly at the forefront of every municipality that I know within an urban market. So what can we do working together, Dr. Wimberly?
Thank you so much, Commissioner. I think that it's going to be very important for us to definitely recognize, like everything that we've said today, that this is going to be something that we're going to have to collaborate with the community to do. As a hospital system, we are definitely there to be a resource, to advocate, and to help with thinking about programming that will be appropriate for community engagement as well as hospital engagement. There are a couple of programs that we already have within our trauma center at Grady that are targeting a lot of the events that are happening in the community. We have several programs in both Fulton and DeKalb County to help those residents who have experienced trauma and trauma-related injuries to be able to decrease the likelihood that that will occur again. And in addition, we are definitely looking forward to partnering. We have a couple of programs on the horizon that we are going to be reaching out to our community partners. Are some great ideas. Our panel that we have here from California has been also very helpful in helping us think about what that looks like to be able to partner with the community to provide those services. So I think it's going to be very important for us to really talk about it and develop something that is going to be a win-win for both the community and its residents. So definitely looking forward to collaboration, having more conversations like this. I definitely believe that, those solutions are going to come from the community themselves versus the hospital system telling them specifically or prescribing, but we're here to ensure that we can advocate and collaborate with our community partners to provide the services that are needed. So, I really do appreciate your willingness to partner with us on this. I think that we need to have more opportunities like this to talk directly to the community to be able to find out what's going to be something that could be successful for us.
Absolutely. And let me say that there are a lot of different organizations and people that are on this call who have been directly affected by gun violence, trauma, homicides, and murder. I know one such person is Miss Betty Maddox, and she has an organization called Grieve. And I'm seeing the comments as I'm trying to multitask here in terms of how can I work alongside the community to provide support and or these organizations. And I'd just like to say, I am happy to serve as a bridge. I see that Allison has also included in our comments each and every individual that is a part of the conversation and what organizations they represent, because this is going to take a conglomerate approach. The issues that we're dealing with surrounding violence is not a one-person solution. It's going to require multiple partners, multiple levels, from our local schools and beyond into the justice system. And I would like to, Mr. Snyder, I want to engage you at this point because I know that you work within the juvenile detention center system. And I want to ask you in terms of violence and what you see from individuals, young people that come into the juvenile detention center. Tell me if there is such a thing as a profile or an individual that has been brought in as a result of violent crime. What is it you see? Is there any particular household type that you see or any particular patterns that emerge?
I wouldn't say there's technically a type that you see, but the only thing that I really notice is, we're really living in a time of have and have nots. Nobody wants to be a have not. So these youth are out here doing anything and everything they can to not be the have not. And they're not seeing the opportunities that they have in front of them. And I think that comes, that's a little bit of place on our shoulders, is we need to start pointing out and creating more opportunities for the youth to where they don't feel that, that hopelessness or that they only have one route to go, because that's not the truth. It is, they can do anything and everything they want to do. They just, sometimes they get blinded by, what they see every day, and they want to replicate that. But once you put them on a path to success and put them around other people who are leading and doing better, it'll just kind of rub off on them. It's like a product of your environment. It's not an excuse. That's a true statement. If you put me around 9 other millionaires, chances are I'll become that 10th one. So that's what we need to start doing with our youth, is just creating opportunities for them to see themselves in better ways.
And thank you so much for that statement, because, again, when we talk about violence, I do believe that it's learned. And I do believe that, and, it's very unfortunate because this is something that runs deep within many communities that have been traditionally underserved, underrepresented, are not given equal access as it relates to economic opportunities. That's one of the reasons that I advocate. I have a program called the Lock-In for Life. And it's an annual event, but it does provide through several local partners, Kappa Alpha Alpha chapter of Omega Psi Phi fraternity, the 100 Black Men of DeKalb. It provides ongoing mentorship. And what we see is when young people have someone with whom they can communicate, that often helps us break the cycle of the behavior that they have, and honestly talks to them about opportunities that exist independent of criminal behavior and violence. When individuals are given an opportunity, it's life-changing and it becomes transformative. But again, as it relates to our school system and how we educate children, how we go about early intervention so that we understand where a child is, if they're in a traumatic environment, if there is a need, whether it be shelter or food, because food insecurities is very real, I found, in many homes. Some children we've found, when you open up to them, and that's why I say to adults, it doesn't matter how much we know until they know how much we care. That's when you fully begin to understand the dynamics of those homes. Now, I know there were quite a few requests earlier for data, and I don't want to move away without going over some of those statistics, because 2 years ago, I believe it was 2019, when DeKalb County surpassed the city of Atlanta in terms of homicides, and nothing has changed there. We don't have this chart to show. However, year to date, this is showing crime patterns between over the course of the past 2 years. Again, what you're seeing here in terms of crimes to persons, meaning personal crimes, you saw in 2021, 595. In 2022, we're already at 1,021. It's more than double. And it's very unfortunate, but when I'm looking at the numbers in most categories, that is what you see as it relates particularly to violent crime. You're seeing homicides. This is from March to April. What we saw prior week, there were 3 homicides. Current week, 2. We're honestly seeing, anywhere from 1 to 3 homicides a week. And if you are watching our local news, you see exactly what I'm saying here. So for us, the data. Our challenge is how do we address the underlying causes that we believe are contributing to what we see so that we can change the trajectory. And at this time, I know that it's already 7:12 and we're scheduled to bring a close at 7:15. There's not enough hours to honestly unwrap this. This could literally be a week-long conference. And perhaps that's something that we need to come together in some type of conference format. But again, I want to say thank you all for joining us. And at this time, I would like to give closing comments in particular to Dr. Dicker and for any other panel members that want to join in with any closing comments on how they can be reached, how they go about identifying partners who want to work alongside them. And we'll just go ahead and start with you, Dr. Dicker.
Well, first, I just want to thank your district, the Atlanta community, for the incredibly gracious invitation to be here, particularly to you, Commissioner Cochran-Johnson. And to say that there is an incredible network nationally, the Health Alliance for Violence Intervention, to be able to provide training, technical assistance. We work with other cure violence groups. So as I said, it's really an ecosystem. And most importantly, hospital-based violence intervention programs, the backbone of them is community. The interventionists are from the community impacted by violence. And so if you join in this membership group, you end up with this incredible group of brothers and sisters doing this really important work. So we welcome you to that, to find a home there. And again, just really thank you very much. You have several champions in the hospital. We have one here, but your entire trauma team has an incredible thirst for doing this work. And Randy Smith in particular has a lot of experience doing this work at another institution. So you're blessed with that, with great partners.
And we are very thankful to have the partners. And Mr. Garner, I do see your hand, and thank you also for placing your contact information in the chat. Thank you.
Oh, no problem at all. I just want to encourage you all to really look at your communities and see who are the individuals who are already doing this work for free. Sometimes, we're loaded up with degrees and credentials and, good career experience, but that's not going to reach our young people. You need some credible messengers that's willing to get down in the dirt, in the mud with these young people, because they understand where they're coming from. They live in the neighborhood. They may have been the influencers of violence once upon a time, but now they're at a point to where they want to be a part of the change that they want to see in their communities. And these young people will respond to that, so just kind of keep that in mind and how that particularly works in the city of DeKalb County.
Absolutely. And thank you so much. And is there anyone else who wishes to have closing comments?
I'll say something. I just want to say thank you so much. Thank you for everyone who attended. Thank you for your time. As Dr. Dicker mentioned, Dr. Randy Smith actually leads that effort at Grady, and Dr. Smith is on as a participant. She has put her contact information in the chat, and so have I. So please definitely reach out to us if you have any specific questions or any opportunities for collaboration, definitely.
Absolutely. And I also want to acknowledge at this point, Mr. Johans Benton. He's with the Juvenile Program Administrator or a Juvenile Program Administrator with DeKalb County Juvenile Court. And he has put his information in the chat. And let me say that if you are familiar with young people in your community or parents who are having issues with their children, please reach out. because we are actively through District 7 providing mentorship opportunities that are so intense and strategic that, you know, I'm familiar with some of our mentors picking up young men because they don't have that father figure in their lives. They don't have the guidance they need. And in many instances, that's when outside influences direct what they believe in terms of how a man should conduct themselves. And there is also an underset that suffer from economic lack. Mr. Snyder touched on that and what he sees. And, you know, I think the term he may have used was by any means necessary. You know, when children don't have and there is a need, it makes them feel, honestly, you know, I've had, you know, some children speak to me and it felt like they felt like a caged animal almost. You know, I don't have this and I'm different and it makes me stand out. So I've had teachers that have reached out who've gone in their pockets to provide clothing and provide essential items. Because when you see us address these issues, that's when you see a change in children. But respect and human decency is something that you can't legislate. This is something that has to be taught. We have to address traditional inequities within systems that has prevented individuals within certain races and classes from having access to equal opportunity. And there was a very powerful comment that I saw that came in earlier from a gentleman, and it really resonated tremendously with me because he spoke of Dr. King and his statements that until we begin to understand, and it was Mr. Ed Johnson, that an injustice to one is an injustice to all, and that we all have a buy-in to ensure the economic success and opportunities for all people. Because when we create an uneven playing field, it's very unfortunate, but you do see byproducts of crime and violence and undesired behavior that affects us all. So the interrelated structure of reality is the word that he used, because we're all in this together, regardless of the color of one's skin, our education level, creed, or color. So thank you all so much for joining us. We'll continue to have this conversation, hopefully for some of you that want to be actively engaged with some of the organizations here. You can reach out direct. Of course, I will be funding through my office the efforts of Attorney Mawuli Davis to come into DeKalb County and visit our apartment communities that have the greatest incidence of crime and violence among young people, as well as funding a program that we did last year that integrated into the school system and juvenile detention centers. So thank you all so much for this conversation, and to all of our panel members and guests, thank you for your time. We sincerely appreciate your presence here.